let's do this, post-lunch session, boring lectures. Everybody knows what heart does, what happens to the heart, how to prevent heart disease, don't smoke, don't eat fried food, all of that. Every lectures you must have heard or you might have read somewhere. I'm going to do this slightly differently to make it interesting and interactive. So what I'll do is, from my own personal experience of treating patients, I will give you 4 stories. One of them is a universal story, not from my experience, but others. Actually, I have seen these events happening. So those 4 stories will give us a little moral. It will be a short session. I should take about 15 to 20 minutes. The rest of the time is open house. I would like all of you to ask questions. My request is, the best way to do this is type in your questions in the chat box. Maybe Ritu or Ankit, one of them can read out the questions one by one, because I may not be able to see the chat box properly. And then I'll answer these questions. Please remember, it is not about what I tell you. It is about what you want to know. So therefore, please type the questions in the chat box at the during or at the end, and somewhere Ankit or Ritu will ask. Let us not speak over each other, so that would actually distract everybody else. So the best way to ask questions is to go to the chat box. Now I'll give you a brief presentation. I have a set of slides prepared. This is about 4 stories that I'm going to tell today. So the first story is one of Dr. Jeremy Morris. Now, Jerry Morris was an officer in the British Army. He served in India. He was in the eastern part of the India when World War II broke out, and he worked very hard during the war. When he retired and he went back to London and said, I have had enough of surgeries, enough of blood, enough of injections, enough of patients. I will do something else for the society. And so he joined the British public health system. He wanted to solve public health problems. So one of the things which he noted was that he went to the London transport system and worked with the workers there. He saw that these double-decker buses, which are there very commonly seen in London even today, he saw that the drivers and conductors had different health problems when it comes to heart. What he saw was the drivers had twice the number of heart attacks compared to the conductors. Conductors were healthier when it comes to heart. The drivers were not so healthy. He wondered, they have the same socioeconomic status, same educational background, they earned the same amount of money, they had the same bad habits. In spite of that, why is there a striking difference between the drivers and conductors? So after study, he came to this conclusion: the difference between the driver and conductor is, on an average, a conductor climbed up and down the stairs 800 steps. 800 stairs he used to climb and come down. So he came up with this very interesting theory. It is in the late 40s. Mind you, those days, cardiologists did not know about the importance of exercise. We knew exercise is good for fitness, to keep thin, to help control of diabetes, but we didn't know that exercise did anything to the heart. So he came up with this concept that this conductor climbing up and down is protecting his heart. To test this further, he went to another London department. He went to the London Postal Department. You see in the picture on your right, there are people who are sitting in front of cubby holes. These are called as sorters. They take the letters and sort them into various address boxes. From there, the postmen and postwomen take the letters to deliver. Now, there are 2 types of workers in London Postal Department. One is the sorters. The other ones are by foot or by cycle. The postmen and women were delivering the letters. And he saw exactly the same thing, that the people who sat and sorted the letters had more heart attacks than the people who walked or cycled. So he came up with this concept that, for the first time, he also did autopsy studies on people who had died. And in 1958, he wrote this seminal paper. This is the first paper which said heart disease and physical activity are connected. From then onwards, actually, Jeremy Morris became a walker. He used to walk every day. He died in 2007 at a ripe age of 99. So there you are, the first story, and the moral is keep moving. So I'm going to share similar small snippets, and after that we'll come to the question answer session. So the second story is time is muscle. This is what I call. This is from a true story from my practice. There is a family in one of the localities in Bangalore, lives in an apartment complex, and in that family there is a father-in-law, mother-in-law, kids, and grandchildren. Everybody in that family have gone on a holiday. The old man, father-in-law, and his daughter-in-law were in the house. At about midnight, the father-in-law developed chest pain. He started sweating. So he knew this is something wrong with the heart. So he called his daughter-in-law and said, "Beti, मुझे लग रहा है heart attack हो रहा है मुझे. So can we do something about it?" So she didn't know what to do. So she walks across the aisle to the opposite apartment, knocks the bell. There is a young couple there, a smart young gentleman comes out and asks, "Kya hua, bhabhi?" He said, "My father-in-law seems to have a heart attack. Can you please help?" So the gentleman walks across into the apartment and asks, "Uncle, kya hua? Kab hua? Kaise hua?" And he also felt there is a heart attack. So he decided, इसी apartment complex में there is a doctor. I play badminton with him. Let me go and get him. So he goes out of the apartment complex. He goes down the lift 10 floors, goes across the yard and the basketball court, goes to the next apartment tower, goes up 8 floors in a lift, rings the bell of the doctor. The doctor is in his pajamas in the midnight. So he comes out. What happened? My neighbor seems to have a heart attack. Can you please come and help? So the doctor goes inside, changes, gets his BP apparatus, his stethoscope, 8 floors, basketball court, yard, 10 floors, comes here. And he examines the patient, takes a history, asks some questions, checks his blood pressure, pulse, and says, "Uncle, I think you are having a heart attack." Okay, everybody knew this all along. About 15 to 20 minutes have already passed. So now what is to be done? So the doctor says there is a nearby small hospital. We will take him there. So they put him in a car and take him there. And outside the hospital, a stretcher is brought. The old man is landed on the stretcher and he is taken into the hospital. There is a duty doctor who examines him and says it looks like a heart attack, and he takes an ECG. By this time, another half an hour has passed and the ECG shows that there is a heart attack. He says this is a heart attack. What is to be done? Then he says, we don't have the facility to admit. We don't have an ICU. We don't have a cardiologist. By this time, the daughter-in-law realized something is seriously going on. My father-in-law is having continuously the chest pain. He is not being given, not even a first aid medicine has been given. So she called the hospital where I am working, and we sent an ambulance. By the time the patient reached, in 20 minutes, the team reached the hospital. We took the patient into the cath lab and did an angiogram, and we fixed the blocked artery, and he was cured. Now, the thing is, almost an hour had passed before even some first aid medication was given. We know that there are times when patient is on the way to the hospital, a cardiac arrest can happen. You saw last time how CPR can be performed to save them. But very many times, patients don't know what to do. And we know that the longer the treatment is delayed, the later the treatment is given, the heart muscle starts getting damaged. It is possible that after a few hours, treatment is given, but by the time a lot of heart muscle is damaged and the heart becomes weak, and after that, the patient may be disabled for the rest of their life. So therefore, we say time is muscle. The faster we give treatment, the heart muscle gets saved. So the moral here is the patient and his daughter-in-law didn't know what to do. I have shown a fire escape plan. You all work in various offices, facilities. You have gone to the cinema, you've gone to hotels and you've stayed there. There is always a fire escape plan. Nobody is drawing the fire escape plan after the fire starts. The fire escape plan is already there. You see the fire, raise an alarm, try to extinguish, get out of the stairs. This is what is told to us. So we should have a similar fire escape plan in our houses. We should think that in my house there is an elderly person, or it could be anybody. There is a suspicion of a heart attack. What is to be done? What is the first aid medication? Which is the nearest hospital? What is the number for the ambulance? And I call, the ambulance comes and picks me up. And before the patient reaches, I am able to call the hospital and say, I am bringing a person. He seems to have chest pain. Maybe it's a heart attack. Please keep your cardiologist or your emergency team ready. And that plan should be foolproof. Maybe I have gone to work. My old mother is being looked after by a caretaker, a domestic person, a maid. She should know which number to call in case of an emergency. So this kind of a plan has to be there in our houses before this kind of an incident happens. So when heart attacks can be very dangerous, and this applies also to strokes, also to falls. Some people, elderly people, fall down and have fractures or head injury. In all these situations, we should have already drawn the plan. What is the hospital number? What is the ambulance number? How do we get there fast? So this is a very, very important lesson we learn from this story. I'll move on to the next story. This is a 36-year-old banker. He was working for HSBC Bank, which was right opposite my hospital. Smoker, a slightly overweight guy, very sedentary person, used to like his beer, he used to like his Chinese food. So he started complaining that my chest is burning. For almost 2 weeks, he was going on saying this. One day he would say that today I smoked a lot, that's why I'm having this gas. Today I had a couple of beers, I'm having gas. Today I went with my friends, we had biryani, so I'm having gas. His wife got fed up. She said, you have so much gas, why don't you go to the gastro doctor? Go and show. So the next morning, the young man goes to the bank and he went to the manager to ask for permission for 2 hours to go and see the gastroenterologist in my hospital. While he was talking to the manager, he collapsed in the manager's room. So by the time everybody came scrambling, he woke up and everybody knew something is wrong. They put him in a car and they brought him to my hospital. It's a U-turn they had to take, and they came into the hospital. As he was getting into the emergency, he had another cardiac arrest. The emergency team got into action. CPR was tried, advanced CPR was tried. I was called, I was operating, I was called down. We took the patient to the cath lab. We did an angiogram. We found that there is a block. We tried for almost 3 hours to save this person's life, but unfortunately, we could not. Now, when a 36-year-old person dies, it's always very tragic. Anybody dies is tragic, but a 36-year-old guy. I came out of the cath lab. I saw a young woman, maybe 32, 33. His wife obviously had a child, maybe 6 or 7-year-old child. I had to tell them in a very difficult conversation that your husband had a heart attack and we could not save him. Now, the thing is, this kind of incident raises some questions. What went wrong here? One of the things I noticed was warning signs were missed. He had this chest burning for 2 weeks. I am not arrogant enough to tell that if he had come to me 2 weeks ago, I would have changed his fate. I don't think anybody can say that. But at the same time, there was warning sign. He could have gone to the gastro doctor. He could have gone to the family doctor. They might have said, look, this looks like cardiac. Why don't you go and get checked? Maybe things would have been different. For the patient, it would have made a huge difference. For the family, now the family, I do not know. He was the breadwinner, whether his wife worked. I do not know what was his background support. Maybe it would have made a big difference to the family. For the society, a very productive young individual, 36-year-old guy, has so much to contribute to the society and the country. We lose youngsters when the warning signs are neglected. So I feel one of the reasons why this warning sign was neglected was at 36-year-old of age, I don't think this young man thought that I can get a heart attack. because it's generally thought that heart attack occurs in older people. Even though now we see a lot of youngsters around us having heart attack, we still, when we have a symptom, think for the first time that it is gas. So this kind of neglecting warning symptoms is wrong, is the story telling us. This is the moral I get from this story. I'll just tell one last happy ending wala story, and then we go on to various question answer session. Now, what happens in a heart attack is there are three arteries in the heart. Somewhere cholesterol depositions happen, and these we call them as blockages. They can be very critical blockages when the artery is very narrow. It can be minor blockages when the artery is not very narrow. But what happens is the blockages cause some kind of a resistance in the blood flow. The blood flows over the blockages without disturbing the blockages. Sometimes when there is an extreme emotional stress, extreme physical stress, the blood flows so fast that it damages the cholesterol deposition, and the cholesterol deposition opens up. We call that as plaque rupture. When the cholesterol deposition opens up, the cholesterol which is inside that blockage, in body temperature, it is the consistency of butter. It comes in contact with the blood, and when the blood comes in contact with this cholesterol, it clots and blocks the artery. So yesterday, a 73-year-old gentleman came. He had a heart attack, and this is the picture of the angiogram I'm showing. I hope everybody can see it. You see a tube coming up from there, and blood is flowing, and blood is getting stuck over this part. It is not moving forward. So this is a blood clot here, which is blocking the flow of blood, and because of that, this person had a heart attack. So we did what is called as an emergency angioplasty and restored the blood flow, and this is how the artery looks. You saw that earlier the blood had blocked off here because there was a clot. We were able to take out the clot using vacuum, and we were able to dilate this block with the balloon, and we have put a stent. You may not be able to see it here. I'm not showing you all the pictures for want of time, but there is a stent in this artery, which is, you can see that black thing, that is a stent. And because of that, blood has flown all the way down to the heart. Whereas earlier, if you saw, the blood was stopping there, and this entire area of the heart was not getting blood supply. If we had not taken care of this in time, one, there was a risk to his life. Nearly 25% of patients with heart attack die. The second thing is that amount of heart muscle did not get blood supply for 6 hours or 12 hours. That area gets damaged, and the heart becomes weak. So in a heart attack, this is why when there is a symptom, there is a suspicion of heart attack, go to the right hospital, which has got the facility to do procedures like this. And with this, lives can be saved, quality of life can be preserved. I stop here. I don't want to, as I said, bore you anymore with lectures. These are the three take homes which we take from this. Physical activity is king. Time is muscle. You have to go quickly. Anticipate. Never think that I am immune. Anyone can get a heart attack. We should think that if there is a symptom, go to the hospital. And we should also think that I have a risk of getting a heart attack. So let me make my lifestyle more healthy. So these are the conclusions from this small presentation. This is my hospital where I work in Bangalore. Now, as I promised before, this is open house. Please ask questions. I'll stop sharing the slides here, and I am here to answer any questions. Ankit, if you can read out the questions which you have seen.
Sure, sir. Sir, one question from Sushant. Is there any preventive medical checkup which help us to analyze current heart condition and predict the chance to heart condition?
Yes. The idea is that anybody can get a heart attack, but there are some people who are more prone to developing heart attack than others. For example, somebody is a heavy smoker, somebody is a diabetic, somebody has high blood pressure, high cholesterol, somebody has a family history. These 5 things: smoking, family history, diabetes, hypertension, cholesterol, these are called as risk factors. What are these risk factors? It's like, you are standing in the middle of the road, a truck can come and hit you. You can, of course, potentially get hit by a truck on the side of the road also, but generally you are exposing yourself to a heart attack if these five things are there. By checking, by getting these factors checked out and taking care of smoking, hypertension, cholesterol, and diabetes, we can move from the middle of the road to the side where the risk of a heart attack becomes less. So this is what is called as risk prevention. So how do we do risk prevention is, first of all, we have to identify the risk. The basic step is to go to a doctor. I do know that today a lot of diagnostic centers and hospitals are offering a blanket health checkup package. But many of my patients come and tell me, doctor, I got a health checkup. I get it every year. This time also I did 3 months ago. All parameters were fine. How did I get a heart attack? The point is the physician's consultation is very important because the physician is going to go into history, habits, and bad habits, which the test will not do. So one has to go to a physician, and there's a number of tests checking the blood pressure, sugar, cholesterol. There are some advanced tests like C-reactive protein. Nowadays, CT scans are available which can predict the upcoming risk of a heart attack. So, a number of tests are there which can be done periodically. Younger people don't have to repeat this. For example, we start, let us say, health checkup at 30 years of age. If a 30 years person is healthy and good life habits is there, every 5 years he can do till he's 50, he or she is 50. And after that, maybe once in a year or 2 years, this can be repeated depending on the health conditions. So preventive health checks are there. But the key point to remember is, if today all my tests are fine, doesn't mean that I can't get a heart attack. Because that is what happens when somebody says, my tests are fine, so I can live the way I'm living. That person may be smoking, drinking excessively, eating unhealthy, maybe sedentary. Just because the reports are fine, we can't rest easy. We have to adopt healthy lifestyle after we get a good report of preventive health check. So both preventive health checks and a preventive lifestyle are very important for preventing heart attacks.
Hope Sushant, your question is answered by sir. Next question, sir, from Anjanelu. Doctor, what are the basic tests that we should go through for early detections of heart health, even if we don't have any symptoms? Things to be normal without any symptoms, but how can we know my heart is doing good?
So first of all, symptoms are very important. You walk, you run, you don't have chest pain, breathing difficulty, good. Then the other tests which I mentioned, check your blood pressure regularly, cholesterol, diabetes has to be checked. There are some advanced tests. As I said, there is something called as high sensitivity CRP. There is an echocardiogram, ECG, treadmill test, CT scan. These are all tests which can be done. I don't advise that we write down a list of these tests and go to a diagnostic center and get it done, because interpreting them will be different. A 30-year-old person doing these tests and a 60-year-old person doing these tests are going to be different. So the tests have to be tailor-made for the individual. So therefore, always consult your family doctor, always consult a physician, and they will tell you what tests have to be done at what frequency, rather than, these are the hard tests and I will do it every year. So that is a very important thing. This test already I have mentioned.
And the next question again from Sushant said, there has been numerous cases of young people getting serious and fatal heart conditions. What could be possible reason how to correct this course?
It's a very important question. I was hoping that somebody will bring up this, because we see a lot of young people succumbing to heart attacks, or at least suffering from heart attack. We have seen very fit people. Somebody died during a cycling event, somebody died during a marathon, somebody was swimming and lost their life, somebody died in a gym. So these are raising a lot of questions. There are two things. One, I think even in the past, young people were dying, may not be this many, but they were dying. But because of social media, it is coming into our attention. That is number one. Number two, I think lifestyles have become very, very difficult now, very bad. If you looked at our lifestyle about the society's lifestyle about 30, 35 years ago, you would see that there was much less smoking. Now, smoking has grown like anything. Everybody smokes. Alcohol consumption has gone bonkers. It is really very high. Our jobs don't allow us to exercise. Our jobs don't allow us to eat and choose healthy food. Our jobs don't allow us to sleep well. Our jobs don't make us stress free. So these are some of the things which have crept up in the society. Lifestyles are unhealthy now compared to, let's say, 2 decades ago. So therefore, when I was young, I'm 57 now. When I was young, people in their 60s and 70s were having heart attacks. Now, people in their 40s are having heart attacks. If this lifestyle continues, the amount of junk food eating, high school students smoking, lack of playgrounds, people sticking on to devices, stress increases, I don't think it will be a very far away day when even younger people start getting heart diseases. So, therefore, one of the prime reason for this is lifestyle. Two other factors also I would like to tell. There are people who getting into fitness. What is happening is many of them get into fitness in a very freaky way. Like somebody in my office decided to join a half marathon. I have never run in my life. This half marathon is 2 months away. I sign up and I start training for it. 2 months is not enough for doing a half marathon. You have to at least train for 1 year. So you are escalating your exercise very fast. People go to gym to become healthy. The gym trainer wants to make you Salman Khan in 2 days. So you start off with a 5 kilo dumbbells. After 1 week, he's giving you a 25 kilo weight. That is when that stress I mentioned, that when the velocity of blood flows very fast, it can break the cholesterol plaque. And at that instant, a person can have a heart attack. So therefore, when exercising, one has to scale very, start low, gradually you have to increase the difficulty of exercise. The other thing is, many people think that exercise will be protective. Doc, I run 5 kilometers every day. How did I have a heart attack? But just because somebody exercises doesn't mean that all their other sins get washed away. We have seen people exercise a lot, party hard in the night, don't sleep well, maybe they smoke. So exercise is a part of a culture. It has to be a holistic thing that all our activities should be healthy. Only we exercise, rest of our life is not healthy, there is not going to be a protection of that. So I think a number of things. And of course, now food, the delivery orders have increased. We do not know what we are really eating. The food habits have changed. We have become more westernized. So lifestyle, exercise, food including, and also a very vigorous increase in the exercise programs. These are all contributing. And of course, there is a lot of stress and sleeplessness in the society, especially youngsters are under tremendous stress. So these are all causative factors for increase in the number of heart diseases and heart attacks and deaths due to heart disease, I feel.
Again, one questions from Sushant sir. Like, what would be the difference between heart attack and cardiac arrest? Arrest.
Yeah, I showed you the picture of a person who had a heart attack who came, the artery was blocked, and we opened it up. So that is a heart attack. There is chest pain, but heart is running, heart is working. The person is feeling the pain. He's able to tell his family members that I'm having pain, so take me to the hospital. So when one of the arteries of the heart gets blocked, the heart muscle starts getting damaged. That is called as a heart attack. Cardiac arrest is when the heart stops. It could be because of extremely slow heart or very fast heart beating. The heart stops pumping. When the heart stops pumping, there is no blood coming out of the heart. No vital organs get blood supply. The main one is the brain. If the brain doesn't get blood supply or oxygen for 3 to 5 minutes, the person will collapse. He'll become unconscious. And unless that heart is restarted, the person is going to die. So this is called as a cardiac arrest. Now, one thing we have to remember is the most common reason for cardiac arrest is a heart attack. But all heart attacks don't end up in a cardiac arrest. Heart attack is damage to the heart muscle when the blood flow stops. Cardiac arrest is when the patient collapses when the heart stops.
Again, one question, sir, from Alam Patel. Is acid reflux and chest burning are same?
The symptom of acid reflux is called as heartburn or chest burn, but sometimes it's a very deceptive symptom. It may be actually telling that there is a heart attack going on, because some patients who come to us complain of chest burning and we see that they are having a heart attack. So this is a very important symptom, because it's not very easy to distinguish between reflux or gastritis and heart attack. Sometimes even experts may fail to diagnose this. Many times we have patients who come to the hospital and they are convinced that I'm having a, gastritic attack or acid reflux, and we do ECG and we see that there is a heart attack. On the other hand, there are times when we see some patient and say, you are having a heart attack, and we do all the tests and it can be completely normal and it may be gastritis. So therefore, merely going by the symptom, it's very difficult to differentiate between heart attack and gastroesophageal reflux. It's always a good idea, if some new symptom comes, chest burning, chest heaviness, chest pain, jaw pain, back pain, pain in the shoulders. These are the areas where chest pain can come, especially associated with tiredness and sweating. May be a good idea to go to a nearby hospital, get an ECG done, seen by a doctor, so that we can diagnose the heart attack quickly and then treatment.
Meanwhile, sir, I have launched the poll so that people can give feedback about this session, and we will take the questions accordingly. So again, one questions from Nagma. I have frequent chest burn and a very sedentary lifestyle. How can I take preventive measures? And since my cholesterol is high, what test should I require? I'm 32-year-old now, female.
Two things. I mean, 32-year-old high cholesterol sedentary life, basically, I don't know. One has to see the patient, but at the same time, it's not likely that you are going to get onto some medicines. Maybe lifestyle treatment should be changed, should be started. But at the same time, what are these chest pains? What are the characteristics? Does it look like muscular pain? Is it gastric pain? Difficult to, kind of assess. So the best way is to go to a family doctor or MD doctor. The second thing is I would like to tell is, this is an open forum. Don't share your medical secrets. If you have questions about your own personal health, you need consult, send it to Ankit, send it to Ritu. They will bounce it to me. I will answer this personally myself. It is best not to discuss our own personal medical issues or our family members' issues here. Let's keep the questions generic, so that it benefits everybody. But in this particular case, I would say it may not be cardiac, but needs assessment. And for the cholesterol and the sedentary life, I suppose one has to adopt more healthy lifestyle habits.
Sir, one questions I have. Can I have omega-3 fish oil supplement on a daily basis, which is triple strength, 1250 mg per tab? I don't have any issues and workout.
I am sorry. I don't think I should be prescribing this. Your physician is the best person. Exactly what I said. Ankit, please avoid questions which relate to personal health. Omega-3 fatty acids are known to be a good supplements. There are some good and there are some side effects also. So these have to be weighed before taking. The best advice will come from a personal physician who can do that. It's not a blanket treatment like, vitamin B12, multivitamin. Omega-3 fatty acids have their own issues. There have been shown to have some serious concerns. So everybody can they take, especially at high doses. What you're telling 3 times is a very difficult, advice to give over a session. So I think best is to look at the overall health and consult a physician.
Sure, sir. I have also mentioned my email ID. Those who have any queries, you can please raise your queries on my email ID directly, and I will pass it to sir. And again, one question from Susmita said, a sign of heart disease are subtle in women. What early symptoms should they look out for?
A very good question. I mean, I'm glad this question was asked. Men and women have different symptoms. It is recognized now worldwide that there is a gender difference, the kind of a bias of medical care towards men when compared to women. It's a huge problem actually. There are several issues. One, our women are very resilient. They don't complain. If a man of the house has a chest pain, he is rushed immediately. The wife herself will take the person to the hospital. But the wife will not complain, because if I tell that I'm having some symptom, the kitchen will close. The children will not get tiffin boxes. Husband can't go to the office. He'll have to apply leave. So somehow in our society, women underplay their symptoms. This is first observation which doctors have made in this country. The second thing is, if a man has a pain, these are researched facts. I'm not. There is an asymmetry between men and women healthcare in heart diseases. I'm telling you, when a man has a chest pain, he's rushed from the office or he's rushed from the house. But when it is a woman, many times, Ma, I'm going to the hospital, office. I'll come back in the evening and then I'll take you to the doctor. This is often seen. When the person goes to the hospital, majority of cases, and these studies have come from Western countries, when man goes with the symptom of heart attack, women go with the symptom of heart attack, the signs are different, the symptoms are different. Unfortunately, how do we diagnose heart attacks have been all studied on men in 100 years. All the symptoms that have been written, that there will be pain here, it will go to the left side, all of that has been studied in men. Systematically, very few studies have looked at symptoms of heart attack on women. So therefore, when women have different symptoms, the healthcare providers, whether they are nurses or paramedics or doctors, they are looking for symptoms of men. So they sometimes miss. So it is real that many heart attacks in women are underdiagnosed or diagnosis is delayed because the signs are and symptoms are different. It is also unfortunately seen that there's a problem with us. When the same hospital or the same emergency has two patients, one of them is a man and another is a woman, we have difference in the standard of treatment given. The drugs, the procedures which we do, that angioplasties or bypass surgeries, are preferentially seen in given to men when compared to women. So this asymmetry has now been recognized everywhere. So this question was good, that women can have slightly different symptoms. So therefore, don't look for that exact chest pain which goes to the left side and sweating and all that. Even if there is a subtle symptom in women themselves or our parents and grandparents who are women, it is better that we suspect and take them. Healthcare professionals have now recognized this asymmetry of care between men and women, and we are very strongly trying to change this system, where we are trying to advise women to seek medical health help early, and we are trying to give medical care for women on par with men. It's a very, very important issue. There is gender differences in the recognition and treatment of heart disease in women, and that has to go.
Sir, again, one questions we have with us. What can be the first aid if there are no hospitals available nearby to control the cardiac arrest or the heart attack?
Cardiac arrest, the first aid is CPR, cardiopulmonary resuscitation. I do not know if all of you were there the last session when Dr. Suhas demonstrated how to do basic CPR. So if not, if you have had recordings, you can see that there are a lot of online tutorials about cardiac arrest. If somebody collapses and the heart is stopped, you can recognize that by looking, feeling, hearing, and understanding that the person has had a cardiac arrest and do CPR. As far as heart attack is concerned, I told the first aid is to reach the nearest hospital which has got all the facilities. I am Dr. Venkatesh. I am sitting in one corner of the city. My friend calls me from across the city, 15 kilometers away, and says, my uncle is having a heart attack. I'm bringing the person to you. I said, don't. In this traffic, you will get stuck. Something can happen on the road. Go to the nearest hospital, which all the facilities available. So that's the first aid. Short of that, the first aid medicine that needs to be given is aspirin. Aspirin is a blood thinner. and it tends to reduce the clot burden in the angiogram, what I showed. And it has been shown that 22% lives can be saved when aspirin is given within the as soon as the heart attack is suspected. Now, aspirin is available in number of brand names. There is a very common brand name called as Ecosprin, which is universal. A lot of people are taking it. Please remember, it doesn't work for heart attacks. Ecosprin is enteric coated aspirin. It has got a coating and it will dissolve in 2 hours and it will not work before that. What we need to take is called as Disprin, dispersible aspirin, which if you put it in the mouth, it will dissolve, or you put it in a glass of water and you can drink it up. There is also another brand name called as Aspisol. I generally don't like to talk about brand names in a session, but these are life-saving medicines. Aspisol, soluble aspirin. So Disprin or Aspisol, 350 milligrams should be available in everybody's house and in every office. If somebody is suspected to have a heart attack, the first thing is give that person, put a Disprin or Aspisol tablet in half a glass of water and ask him to drink, and then go to the nearest hospital. Life-saving first aid. There is another misconception. A lot of people think that there is a tablet called as sorbitrate. If you get chest pain and suspect heart attack, put the sorbitrate under the tongue, because this is what the older doctors used to tell maybe 25, 30, 40 years ago. This is a harmful practice. In some cases, the sorbitrate tablet can actually reduce the blood pressure. Because of that, treatment of the heart attack can become dangerous. So please do not give sorbitrate, give aspirin.
Yes, sir. And one more questions we have with us. When you say family history, how we should be considering the history, sir?
Very good. Family history is only first degree relatives. That is your parents, your brothers and sisters, and the children. In the sense that if there is a 70-year-old person who comes to me and his 40-year-old son had a heart attack, that also becomes a family history. So we are not talking about great grandfather, grandmother, uncles, cousins. No. When it comes to heart attack, family history is parents, siblings, children, first degree relatives.
Again, one questions we have, sir. Most doctor advise stop alcohol, smoking, have healthy food, but people with no history of alcohol, smoking, and following healthy diet getting heart attack. What could be the reason?
See, we do not really know, because heart attacks, heart diseases are not like malaria. You know, we know that there is a parasite and the mosquito bites, and because of that we get. So these are called as unifactorial. There's one factor which leads to malaria. Whereas diseases like heart disease, heart attack, are multifactorial. It could be because of cholesterol. It could be because of uncontrolled diabetes. It could be because of smoking. So as I said, these are all risk factors. That doesn't mean that if somebody has all the risk factors. Let us say there's a person who's smoker, has alcohol, has hypertension, has cholesterol, has diabetes. It doesn't mean that that person should have a heart attack. It's just that his chances are more. Again, it doesn't mean that if you don't have any of these risk factors, one cannot get. Even the most pious person with no risk factors, no bad habits also can get. There are people who have this. Doc, I exercise regularly, I eat healthy, I don't smoke, I don't have sugar, BP. How did I get a heart attack? Because there are some things which are unexplained. This is a multifactorial disease. So therefore, while it is random that some people can get heart attack because of no reason, in many cases, in almost most cases, we are able to identify that factor. It could be a single factor. So we say improve your lifestyle and hope that we don't get a heart attack. And periodic checkups will help in these patients, people who don't have any other risk factors, to see whether new things come up. I may not be diabetic today, but what happens next year we do not know. So periodic checkup can be done. So risk factors are like that. If the risk factors are there, the chance of a heart attack are high. It doesn't mean that if you don't have risk factors, you can't get. The percentage of people without risk factors getting a heart attack is very low, but some people without risk factors also can get the heart attack.
Sir, one question we have. Is visceral fat around the abdomen causes high rate of heart attack?
Yes, there are studies which say that visceral fat um, is a metabolic problem. It is not just for heart attack, even diabetes, cholesterol, hypertension, all of them can increase with patients with high visceral fat. It basically suggests that our dietary habits may not be good. We may be eating too much carbohydrates, and there is some condition called as insulin resistance. It's a thing which is an abnormal metabolism, and these can suggest that that person is at a higher risk. It's not that it will cause the heart attack. Something that can cause visceral obesity can also cause heart attack. It's not that visceral fat is directly going and causing the heart attack, but these are signs. If somebody has high visceral fat, visceral obesity is there, then there's a chance that that person may develop heart disease.
Sir, what are the tests we need to go for any blockage of heart attack related issue?
So I told you the basic health preventive health check. If you do, majority of the people who don't have any problem will get filtered out. In spite of that, if more tests have to be done, today CT scans are available. In case the suspicion of heart disease is high, people can even undergo what is called as a coronary angiogram. There are tests, but it's not very easy to tell everybody should get a CT scan or everybody should get a angiogram, because that's not correct. So therefore, basic tests for the heart like ECG, treadmill test, echocardiogram, a physician consultation has to be done. And in those patients, people who the doctors feel that there's a chance that there may be blockages, there are advanced tests available, and your physician or the cardiologist is the best person to advise you.
Sir, one question from Vidyut. What is the sign of heart attack? Like how someone can identify that it is a sign of heart attack, should go for a hospital, and what the steps should take before reaching the hospital?
I think we have discussed all of this. Anyway, I'll tell you once again. Chest pain in the center is the most common heart attack sign. The pain can go to the left side, right side, back, neck, jaw, but it's a continuous pain. Heart attack pain is generally very severe. It's one of the most severe pains in most cases. Some people can have mild pain as well. If there is associated with that, there can be some sweating, some giddiness, some tiredness. These becomes symptoms of heart attack. Some people, very old people, may not have chest pain. They may simply feel breathless or extremely tired. Extreme sweating can come without any chest pain. Even then, if it is happening for the first time, we can suspect a heart attack. And first aid, I told you, aspirin to be given, take and call the ambulance. That is the only two things which one should do. One should not wait at home.
Sir, how to differentiate between gastro issue and heart issue?
I told you we cannot. Sometimes even expert doctors are not able to. So when there is a doubt of any new pain, go to the hospital. They'll do the ECG and they'll tell you. Supposing it is proven that this is gastro, there is a reflux pain, and you go to the doctor. Doctor says no, this is not heart attack. Don't worry. If you get it the next day, please don't run again. There is no need. So this has to be decided once. If somebody has a first time chest discomfort, you don't know whether it is gas or heart attack, go to the hospital, go to a nearby clinic, get an ECG done, get the physician to evaluate, and we will come to know whether it is heart or gas. And the problem is kind of sorted at that time. There is
Sir,
no other way to
yeah.
differentiate.
Sir, one question from Hardik. What is the minimum time we can walk to avoid heart attack? I have heard that 45 to 60 minutes of continuous walk will keep the heart healthy. Is it right or a myth?
Well, exercise is one of the preventive steps for preventing heart disease, heart attack, reducing cholesterol, BP, sugar. What is recommended is 150 minutes of exercise in a week. So that means 30 minutes of walking for 5 days. There are some studies which have also looked at longer hours. In fact, there is one study which has said that 450 minutes in a week is very good. But I feel what your colleague said is correct. About 45 minutes of exercise should be sufficient, because if you do more, there is no incremental benefit. So I suggest to my patients that you do 5 minutes of slow walking, which is warm up. Do about 30-35 minutes of brisk as possible for you. And that is the exercise. And another last 5 minutes of slow walking, which is cooling down. More importantly, nowadays people are recognizing that walking daily, doing aerobic exercises daily or cardio daily may not be the only exercise you need. You may also want to have what is called as strength training. So today we know that muscle loss happens as we age, and that is also important for our metabolism and later, of course, bone health, etc. So therefore, today the impetus is on, let's say, 3 days of walking and 3 days of strength training. Strength training doesn't necessarily mean bodybuilding, but moderate weights to maintain the strength and tone of the muscles. So these are also equally important. So my exercise prescription for most people would be do 3 days of cardio and 3 days of strength training, and every day do what is called as core exercises. You know, the planks, the crunches, which keep our central muscles strong. So that would be my exercise prescription for most people.
Sir, please let us know if there has been any study where the pollution and passive smoking has any relations of adverse effect on health, on heart. Also help us what practice we should adopt, change in kitchen to support good heart health.
Changing what? Sorry?
Kitchen.
Kitchen. Okay.
Yeah.
So pollution and passive smoking. Passive smoking has been shown to have increased heart attack and cancers. Pollution, a lot of studies are there, but these are all not systematic because it's very difficult to study pollution. If you want to study pollution, you should have two persons in the same city eating the same food, one person exposed to pollution, one person not exposed to pollution. Because you put the patient in some other place, everything changes. Their eating habit changes, their walking changes. You can't compare, for example, a villager with a urbanite because their conditions are different. So there are some studies which say pollution contributes to poor health, but nothing concrete. But passive smoking, yes. Change in the kitchen, I think now we realize that all this talk about you know, not eating dairy products, not eating saturated fats, not eating red meat. So this is all not really accepted much now. We know that the single most important reason for chronic diseases like hypertension, diabetes, cholesterol, heart attack, and some people even say cancer is sugar. Refined sugar, sweets, and excessive use of carbohydrates. Carbohydrates are basically, we are talking about rice, wheat, millets, etc. Excessive use should not be there. Refined carbohydrates in the form of maida, the bakery items, the pastas, pizzas, burgers, which are commercially manufactured, they all contain very high amount of what is called as refined carbohydrates. So the single most important change in your kitchen I would love to see is cut out sugar, free sugar completely, reduce use of carbohydrates, increase vegetables, increase dals and pulses, have more eggs, have more meat of various types so that nutritionally you are balanced. The balance has to be 30%, 40% carbohydrates, 30% fats, and 30% proteins. Our diet is woefully short of fats and proteins. Therefore, our majority of our food is heavily carbohydrate laden. I can have rasam rice in South India, which is 100% carbohydrate. So that proportion has to be changed, and therefore we have to reduce the carbohydrates, increase protein and fat content in our diet. So therefore, the single most important change you should do is cut out sugars, cut out refined carbohydrates, and reduce the overall quantity of carbohydrates consumed. Rest of it is all not that important. We talk about different oils. The amount of oils which is used is actually not very high unless somebody is used to eating out every day. Dairy should be had because milk and milk products have a lot of vitamin D, E, and K, which are very important for our other metabolic activities. So those are minor changes. The major change is to concern carbohydrates.
Sir, one question from Alexander we have is having mental stress worse than an imbalanced diet when it comes to heart attack related issue?
You can't compare. I mean, in a person, let's say somebody is smoking and has diabetes and has a heart attack. How do we say this heart attack was caused by smoking and not by diabetes? There is no way. If somebody is stressed and has poor food, if that person gets heart attack, we can't say, no, 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 his food is okay. His mental health only created the problem. I think all factors are equally important because we cannot really differentiate. And it is also true that mental health issues lead to poor habits. There is more comfort eating. Therefore, somebody may binge on chocolates or sweets. So, mental health also indirectly reflects on the dietary habits, exercise, and bad habits like smoking and alcohol also. So, therefore, I think these are interrelated. We can't say which is more important, which is less important. As physicians, as uh, people who are looking at good health, we should try to control all the factors.
Sir, one question from Ved. Palm oil being the leading cause of heart disease in India and is part of 90% plus packaged food items. And restaurant also using this mostly cause of supply and demand. India being the largest importer of palm oil. What are your takes on it? Personally, stopping palm oil has no effect on the society consuming it. So what method can we take to educate people on a massive extent?
This is a question is very dear to my heart. I think in the 1980s, mid 80s, before that, Indians were having cold pressed oils. There were no refineries, chemical refineries were not there. Oil mills were there. In Karnataka, for example, groundnut oil. In Tamil Nadu, it was sesame oil. North India, mustard oil. Coastal plains, coconut oil. These were pressed, there were cold presses, both ox driven or even machine driven. And we were manufacturing groundnut oil, sesame oil, and all that. In the mid 80s, we started importing palm oil, and palm oil was very cheap. And the, plus, these are all, there is also another set of oils. These are called as seed oils, like the sunflower oil, safflower oil, canola oil, rice bran oil. These seed oils also have a poor omega 3 to omega 6 fatty acid ratio. So these can cause a lot of inflammation. It is true that India is the largest importer of palm oil. It is true that palm oil is used by commercial establishments to reduce costs and increase profit. But what we also don't understand is the so called refined oils which are sold in the supermarket, which we use at home, are blended with palm oil. How do we know that? During COVID, there was a time when the Malaysian and Indonesian palm oil imports stopped because of lockdown. At the time, if you remember, in 2020, there was shortage of oil in the supermarkets. People were buying it at high cost and keeping it. Why? Not because sunflower oil was not available, but the sunflower oil which we eat, 30 to 70% palm oil is mixed, and these are basically blended oils. So not only in the commercial establishments, even in our houses, we are using palm oil indirectly. And there is some rise in the number of heart diseases, cholesterol, metabolic problems, cancers, etc., which people, there are some experts who attribute it to palm oil directly or indirectly, or vegetable seed oils themselves, directly or indirectly. There is no proven research on that. It's very difficult to do nutritional research. Let me tell you, it's extremely difficult to do nutritional epidemiological research because how do you ask people what do you eat? They have to write down and give it to you. Who is going to do that? So we suspect that this is the case, what your colleague asked. At the same time, what can be done if you really want to change that? There are now cold presses available all over the country. You take your own groundnuts, you take your own coconuts, you take your own mustard, and they'll cold press it and give. There is a difference between cold pressed oils and chemically extracted oils. Chemical extraction of oils is a highly efficient process. It takes out about 70 to 80% of oil content within the seeds. But what it doesn't do is it doesn't take out anything else. It just takes out the oil part of it. when you do a cold press, it's an inefficient process. From each seed, about 30 to 40% of the oil only is taken. But in addition, other nutrients like minerals and vitamins which are present in those seeds are also taken out. So therefore, cold press oils are probably more holistic, more wholesome, more healthy than the chemically extracted vegetable seed oils blended with palm oil. So this change has to be conscious. Depends on the amount of oil that is used. If you are able to cut down outside food, fry less, or fry in ghee and butter, which are definitely more healthy, then you may not have to switch this. But otherwise, there are purists who go to cold presses and get cold pressed oils.
Sir, again, we have one question. In case someone does suffer from a heart attack and he and she is alone, what is the best way to tackle that things?
That is what I told. Time is muzzle. If somebody has a heart attack, has to call an ambulance, because I mean, it is not wise for that person to drive. Call for help. Call someone. Say that take me to the hospital, or call an ambulance saying that I live alone. I need to get to the hospital. So that's one cannot treat heart attack at home. One can't lie down and wait that heart attack will go away. It's not fever which goes off with paracetamol. So one has to reach the hospital. That's very important. How do you do it? Whom do you call? Is something which you should plan today. Everybody should have for our own houses.
Sir, when someone feels that it is a sign of heart attack along with CPR, can we give aspirin or ecoaspirin to the patient when the medical treatment is going to get delayed due to?
Aspirin, I have already told. Aspirin has to be given if a heart attack is suspected, not ecoaspirin. That also I explained. And whoever asked this question can go back to the recording and see what I explained about aspirin. How many more questions?
Just I think we will take last questions from Abhya Dalvi. Which oil and which food is to reduce heart attack? As I get when I to him by stairs, I'm not able to understand your questions, Abhya.
He says he gets tired and it affects to the chest. So if you are having tiredness when you are climbing, and if there is a discomfort in the chest, the first thing you have to do is not the oil. Please go to a doctor, get it checked. And as I said, oils, which oil is the best is, people talk about olive oil. It's not very practical, very expensive, and also doesn't suit Indian cooking. I would suggest cold pressed oils, or use whatever refined oil you use in a smaller quantity. And which food I told you, cut out carbohydrates, cut out sugars and reduce carbohydrates. That would be the most. I'll take that last question about whey protein and then we'll stop. Is it okay? Now, whey protein, in my opinion, is healthy. It's made out of milk, and it comes out of milk. It's a different protein than casein. But there is a problem with the whey protein which is available in India. Somehow the Indian cow or buffalo milk is poor in protein. Therefore, it's very expensive to make whey protein. So we are not getting good quality whey protein in India. So I advise whey protein for vegetarian patients, because vegetarian patients have very poor protein sources. So if you have to have some protein supplements, whey protein is one of the ways to go. There is no problem in prescribing whey protein to heart patients or patients with blood pressure, in my opinion.
Thank you so much, sir. Sir, I think one questions we have left is ECG mandatory even if there is no BP or abnormal pulse?
I don't know. If there is a symptom of chest pain, then ECG is mandatory. Even if BP is normal or pulse is normal, ECG is mandatory if a heart attack is suspected. The first way, the primary modality by which you detect a heart attack is by an ECG. So there cannot be a diagnosis of heart attack without an ECG. So if a heart attack is suspected, please do an ECG. Stay true to your heart. Take care of your hearts. Get healthy. Be healthy. Thank you very much.
Thank you.